Hello, everybody, and welcome to Health Confidential with Simone Gisondi, the podcast where the secrets of the body meet the mysteries of healing. Each week, I explore the powerful world of holistic medicine, blending ancient wisdom and cutting edge science, conventional insight, and unconventional truths to decode some of the toughest cases and the most misunderstood conditions. I'm a certified holistic cancer therapies practitioner, a registered holistic nutritionist, and certified regenerative detoxification specialist. I am not a medical doctor. This podcast is for informational and educational purposes only. The diagnosis and therapies discussed here may not be right for you. Please consult a qualified healthcare medical provider before making changes to your health. To learn more about my work or to experience the power of the custom-made healing protocols that I develop, designed specifically for your unique body, your unique biochemistry, your history, and your internal terrain, visit simonegisondi.com and book a private consultation with me. And if this episode speaks to you, follow me on Instagram at simone.gisondi and share this episode with someone you love. Thank you for listening, and welcome to today's episode of Health Confidential. Hello, everybody, and welcome back to Health Confidential. Today, I welcome one of the most important men and the most important figures in the world of medicine, a man who has lived through both sides of medicine, really, the promise of discovery and the punishment of speaking inconvenient truths. And that is none other than the one and only Dr. Andrew Wakefield, a highly trained gastroenterologist, once at the height of his career in the UK, whose research into the gut and its connection to the neurodevelopment brought him into the spotlight and eventually into the fire. And of course, for those of you that know his work as closely as I do, what followed was a storm that stripped him of his credentials and branded him an activist. Yet, with a lot of courage, he has continued to stand by what he saw, what he heard, and what he believes parents and the world actually need to know. So this conversation, I want just right off the bat for all of you guys out there listening to know that this is not about labels, but it's about humanity. It's about courage. And of course, the pursuit of understanding children's health. I'm a parent myself, and I want that to be in a world that is often silenced. And obviously, Dr. Wakefield is one of those figures that was silenced. And he has spent decades looking at the links between gut health, vaccines, and chronic illness. So today, in our conversation, we're going to dive into that body of work, because if we're truly committed to healing, every perspective needs to be heard so that when we make decisions about our health, we make them with all information at hand. Dr. Andrew Wakefield, it's such an honor to welcome you to my show. Please welcome.
It's a great pleasure to be here. Thank you so much. And greetings to Canada, where I spent some of my academic career in Toronto.
In Toronto, yes, that's exactly where I am. And of course, the one and only University of Toronto that I was a student of course, was the university that welcomed you. And I'm sure you left your mark in even in the way that medicine was taught to the students, because I actually was part of that world as well. So thank you for everything that you've done when you came to Toronto and spent the time here in Canada. Now, I know that many people, I want to start off right at the beginning. Many people know your name. I studied your work deeply, obviously for very personal reasons of my own with my children, but a lot of people do not know your story. So before the headlines, who were you as a doctor, as a scientist, and as a man dedicated to medicine?
Right. Well, I trained in medicine. I graduated in 1981 from St. Mary's Hospital in West London, part of the University of London. I was one of 6 generations of my family to have graduated in medicine at St. Mary's: brothers, uncles, aunts, father, mother, the whole lot. So it was in my blood. And I was an entirely mainstream physician, whatever that means. I'm not sure anymore, but I became a surgeon and became a fellow of the Royal College of Surgeons upon graduating, and a fellow of the Royal College of Pathologists. And I ran a big research team at the Royal Free Hospital, which is, again, part of the University of London. And we were looking at the origins of inflammatory bowel disease. These are enigmatic conditions like Crohn's disease and ulcerative colitis that are epidemic throughout the Western world, and we have no answers as to what's causing them. But they've gone up dramatically and appeared in children in the sort of mid 70s, and unheard of in children before, and now occurring in very young children. So something was happening, and there was a huge focus on treatment and the pharmaceutical approach to this, but very little interest in actually getting to the bottom of what was causing it. And we started looking at vaccines, and that led to parents calling me in 1995. I started getting calls from mothers saying my child was perfectly fine. He was developing normally, had speech and language interaction with his siblings, and then he had the MMR vaccine in many cases, and within a few days he'd had a seizure, he'd stopped speaking, never spoke again, and was ultimately diagnosed with autism. I said, I'm terribly sorry, may I stop you there? Because I am a gastroenterologist. I know nothing about autism. When we were at medical school, the prevalence of autism was perhaps less than 1 in 10,000. We weren't even taught about autism. It was so rare. So I said, you must have got the wrong number. They said, no, Dr. Wakefield, the reason that I'm calling you is because my child has terrible, intractable gastrointestinal problems, pain. I know they're in pain. They've lost the ability to speak, but I'm their mother. I know they're in pain, that they've got bloating, they've got alternating constipation and diarrhea, failure to thrive, all the cardinal features of an underlying inflammatory bowel disease. And yet the doctors and nurses to whom they'd spoken had said, that's just part of autism, get over it, put your child in a home, have another one, forget about them. I mean, this was the state of play of autism when I got into it. Absolutely disgraceful that not only were the medical profession ignoring the parents and their stories, which is fundamental to clinical medicine, but they had nothing to offer this child. It was put them in a home and forget about them, move on. It's incurable. And so I put together a team of some of the top researchers in the field of gastroenterology, pediatric gastroenterology, and we investigated these children. Lo and behold, the parents were right. The children had an inflammatory bowel disease. It wasn't Crohn's, it wasn't ulcerative colitis, it was something new. It was subtle, but it was nonetheless, there it was. And not only that, when we treated it with the kind of treatments that we would use in inflammatory bowel disease, anti-inflammatories and probiotics, which were in their sort of early days at that stage, dietary restrictions of gluten and casein, children made dramatic recoveries in many, many cases. Now, flies completely in the face of belief about autism, which is incurable. You can't treat it. You can't get it better. Forget it. No, it's lifelong. That's it. Well, here the parents had proven the medical profession completely wrong. The children had an inflammatory bowel disease, which the doctors and nurses had denied, and intervening from the gastrointestinal perspective, altering their diets and putting them on medication to reduce inflammation, produced improvement not only in the gut, but in the brain. So it's fascinating, absolutely fascinating. You would think that medicine would be all over this, but the resistance was huge. But it was nothing like the resistance to the idea that the vaccines may have triggered it. Now, the parents were right about everything they told us. The medical profession was across the board completely wrong. And so when the parents say my child regressed after a vaccine, we have a professional and moral obligation to take that very, very seriously. But that's not what had happened. My colleague said, Andy, we don't want to get involved in this because we cannot be seen as pediatricians to criticize the safety of MMR vaccine. It made me furious. I said, what do you mean? What are you worried about? Your reputation, how your colleagues might, see you at the Royal College? Really, your commitment here is to your patients. That's where it should be. They come first and foremost above anything else. But no, they put themselves first, and it was very sad. And then The dean of the medical school took me aside and said, if you continue this vaccine safety research, it will not be good for your career. That kind of
Oh,
made me
wow.
angry as well, because there was an overt threat that, we're going to put an end to this. And that's exactly what happened. Exactly what happened. And he was, in that respect, he was absolutely right. It was not good for my medical career. And I continued. I came as a professional and political exile to the United States and continued the work in a private research institution looking after children with autism. And because I was continuing the work, they had to go one step further. So at that stage, they sought to take away my license, which they ultimately succeeded in doing, and made all kinds of allegations of fraud and child abuse. And absolutely, people are familiar with this now in the wake of COVID. People have seen doctors
Yes.
silenced across the
Hmm.
board. Doesn't matter how well published they are, how um, qualified they are. Like people like Peter McCullough, the
That's
most
right.
cardiologist in the history of medicine in the world, this
Yes.
in a moment because he questioned government policy, CDC policy, and vaccine safety. And so people are now used, they're familiar with this idea of cancel culture. Then it was it didn't happen. There was me on one side. And then on the other side, there was the World Health Organization and UNICEF and the British government, the American government and the American Academy of Pediatrics and the Royal College of Pediatrics and Child Health and the drug companies. And so, and then this isn't, I feel sorry for Andy Wakefield, so it's just a fact of life, of the way the world was then. And so uh, it was a little overwhelming. And they controlled the media, so they could say what they like.
Yeah.
Um, So it became a little difficult. They took away everything. I had nowhere to go. No, I thought, right. Over the years, because of the position I'd taken, people came to me from the pharmaceutical industry, the vaccine manufacturers, and from federal agencies and said, we've done a terrible thing. Here is the evidence. Whistleblowers. So I became
Really?
like a repository for whistleblowers. And they had some amazing stories. And I decided that now was the time to turn these stories into film.
Yes.
Then around 2004, I started screenwriting and took it very, very seriously being an academic. I studied everything and I read everything and I went on every course I could go on. And then I became a director as well and made films about these stories. And the power of film was manifestly obvious. It was extraordinary. I mean, I'll just tell you, listeners, the first film I made was not meant to be. We didn't make it as a film. We were just recording this family, a tragic story of a child up in Chicago who was in 4-point locked restraint, chained to a bed in the pediatric
Oh
intensive
my
care unit. A very
goodness.
big child, very violent, and they put him on 28 psychotropic medications.
Oh,
And they were giving one to offset the side effects of the last to do it, and it just they got themselves into a complete mess, and that was what was making him violent. But violence led him to be incarcerated and chained up effectively for something like 80 days. Well, we went there and we got him out, and we were going to take him. We took him to New York to get scoped because he had gastrointestinal issues. And we got him diagnosed by Dr. Krigsman in New York, and he was put on the right treatment, but his mother had nowhere to live. They were driving around, the mother, the godmother, and the boy, driving around Chicago, going from hotel to motel. And every time they got into a hotel room and he heard a siren, of which there are many in Chicago, then he would destroy the room. They're coming to take me away again, and he would go berserk. Poor fellow. So in the end, we got a call saying he's back in pediatric intensive care unit at Lutheran Hospital in Chicago, and we went to see him. Then we left and we tried to find somewhere to take him where he could be recovered from this in a safe environment. That week, I got a call saying that his mother had stabbed him to death and tried to take her own.
no.
She could take no more. She was
Oh,
when we last saw her, she was completely broken. The media, the local
oh,
media, portrayed this as a mother who hated her
Oh my
autistic child
God.
and wanted him dead. And it was completely false.
Oh my
We'd followed this
goodness.
family. We'd followed their journey, their travails. It was tragic. She loved him, but she could not bear to witness his continued suffering. And so she tried to take her own life after taking his.
Oh
And she
my
went
God.
to maximum security prison, and she was going to be arraigned on a charge of aggravated murder, no chance of parole, as with the godmother. And I got a call from her lawyer 4 years later. She still had yet to go to court, but she was imprisoned. And the lawyer said, Andy, I got a call the other day from the state's prosecutor who's responsible for putting her in prison. We'd made a film by this stage, and he said, the state's prosecutor said, I gather a film has been made about this. We'd like to see it. And so the lawyer sent them the film. They called him back and 2 weeks later and said, we've watched the film. We can no longer prosecute this case in the same way. She will be released from prison next week. And that's the power of film. None of this is to exonerate her from killing her child or,
Wow.
supporting suicide, any of those things. It's about the power of film to bring the truth and change
That's
people's.
right.
That's what it's about. And so it made me think, you know what? I need to tell these stories. And that's what I've done ever since. So our last film won 34 film awards. That was a narrative feature, a typical movie
Yeah.
uh, about fraud at Merck. And not that winning awards is what we're about. In fact, it's dangerously close to becoming respectable, which is somewhere I haven't been for a very long time. But the power of film. So that's what I do as a filmmaker now. Having been an academic, a boring old academic who published 150 papers, now I make movies.
No, you are a hero, and I think a lot of the doctors that have come out to actually speak to parents so that we have the information that, of course, you have studied to its depth to educate us so that we can make those decisions. I certainly did that about my own children, and much of what you said about Merck. Um, if you are referring to the Gardasil vaccine, the my son, we were actually threatened with expulsion from school because I would not sign off on them vaccinating him. And this was at a time when he wasn't even sexually active. So this was obviously for the anti-HPV vaccine. And so it was a huge battle between me and the public health of where I lived at the time. And it was a battle to be able to get my son to continue to exercise his right to education here in Canada so that he can continue to go to school. So thank you for all the work that you do. I certainly think that your films and everything that you've published have been tremendous. I followed your work because I wanted to educate myself on a lot of these topics to be able to protect my children and my family. And certainly, I think a lot of people should be doing this from a place of prevention and proactively so that they too can make decisions about what's right and what's wrong for their children and themselves with all information at hand. But I wanted to ask your position, would you say, was never to ban vaccines outright, but to study them more deeply? This is what I understood about your work. Can you clarify in your own words, what were you calling for at the time when you brought all of this to light?
Well, the first publication on autism and the link with, or the possible link with MMR vaccine came out in 1998. And at
Yeah.
that stage, I knew very little about vaccines.
Hmm.
I had decided to start researching it because if I was going to, speak to it in public, I really needed to understand it. That was my duty, my responsibility as an academic physician. And so
Hmm.
I went into the details of every pre-licensing safety study ever performed on measles vaccine, measles rubella vaccine, or MMR vaccine, measles mumps rubella vaccine. And I thought, I must be missing something. I'd analyzed all of these studies. So I thought I must be doing them a disservice. There must be a proper, fully controlled, age matched cohort study in children of the appropriate age that's large enough to find an effect or not and to be credible. And there wasn't one. There wasn't one. What I found is that the early safety studies of these vaccines were conducted on children in institutions, children with severe physical and mental problems who had been institutionalized and were therefore available as guinea pigs for the system to test these vaccines on, without any regard to their health or their well-being. And it was absolute disgrace. And so I came to the conclusion that others have come to now, including Robert F. Kennedy and the CDC, that the studies simply were not there. So any claim that these vaccines are safe and effective really falls very, very short of what is required at the scientific level as a standard of proof. And so that it was an interesting time for sure. I'll just tell you a little story about what really convinced me, because my findings suggested that there was a link, and my position was further research needs to be done.
That's right.
We don't know whether this is a cause or not. We can't say, but further research needs to be done. Everything was done to stop that further research. They did not want to know. The man at the Department of Health or whoever it was simply didn't want to know. Except I was called to talk to leaders from the CDC and the National Institutes of Health and the FDA at a meeting at Cold Spring Harbor in about 1990. And they said, look, Dr. Wakefield, every child gets MMR, only a few get autism. How do you explain that? Well, that's medicine. A lot of people smoke, only some develop lung cancer. Why? We don't know. There are certain risk factors, like the amount you smoke and how young you were when you started, all this kind of thing, but we really don't know why some do and some don't. And the same with that. But I believe that it's in part age of exposure. The younger you get the vaccine, the greater the risk. Why? Because for natural measles, if you get measles under 1 year of age, then you are at greater risk of a severe outcome than if you get it later in life when it's very mild. So there is an age-related effect. Now, we all know this because we've seen it with COVID, that the older you are,
that's right,
the frail you are, and the greater the risk of an adverse outcome from COVID infection. So people are now familiar with this age and risk association, but they weren't at the time. And so the CDC said, okay, we'll look at that. They went away and they did a study. They did a study in the Atlanta metro area of children looking at age of exposure to the vaccine. And they confirmed that it was absolutely correct. That children who got the vaccine younger, on schedule, 12 to 18 months, were at significantly greater risk of developing autism than children who got it later, after 24 months or 36 months. What do they do with that information? Well, they set out to do a study that they should have published, but they found something that they did not want to find. So what did they do? They destroyed the original data. They got together one weekend when no one else was at the CDC, no one could see them do it, and they took all of this information and they put it in a dumpster and destroyed it, and they published something completely different, exonerating the vaccine. And this is the story behind the movie Vaxxed.
Yes.
The disclosure. And one scientist, Dr. William Thompson, who was the lead author, he designed the study, collected the data, analyzed the data, written the paper, said, I can no longer live with this. 14 years later, he came forward, said, I can't live with this any longer. We cheated, we committed fraud, we put millions of American children.
Yes.
And here is the original data that I kept because I knew it was illegal to destroy it. My colleagues destroyed theirs, but I kept mine. And so we made Vaxxed based upon the certain knowledge. It wasn't my opinion. It wasn't Del Bigtree's opinion, my producer. It was fact coming from a senior scientist at the CDC who was instrumental in conducting this study. And so we knew that we were not going to get sued. And if we'd made one mistake, told one lie in that film, we would have been sued to the moon and back again. There was not a whisper, not a whisper, because they knew it was true. And so that convinced me beyond any doubt that there was a causal relationship between the vaccine and autism, not just because of the data, because of their findings, but because of their need to destroy the documents and cover it up. And when that happens, you know that they know, and the game is over. And that brings me to something really, really important I want to share with Canadians. And this is a Senate hearing that took place Tuesday last.
Yes.
And this is a revelation by Aaron Siri and Dale Bigtree, who
Yes.
did an investigation where they said they went to a ardently pro-vaccine doctor, very eminent doctor in Michigan at the Ford Health Center. And they had a very large database of children they'd followed for health conditions. And so it was prospectively collected data. And they said to him, look, you don't believe vaccines cause chronic disease, including autism, so prove it. We'll shut up. If you can prove it, we'll stop making these claims. You've got the database, you're the expert, you want to exonerate vaccines, do the study. Compare the health outcomes in fully vaccinated or vaccinated children compared with unvaccinated children, the gold standard that should have been done from the outset. And he said, yeah, okay, we'll do that, confident in the belief that it was going to show that the vaccines were safe. It showed completely the opposite. Now, they had undertaken, this doctor had undertaken, his name is...
Dr. Offit?
No, Zervos. Dr. Zervos had undertaken that whatever the data showed, whatever the results were, they would publish the study. This is absolutely essential in science. The CDC had violated that already. They'd found something and destroyed the documents, refused to publish. He promised that whatever the results, good or bad for him, they were going to publish the results. When they got the results, he refused to publish them.
Oh.
And he told them that the reason was that he was frightened of losing his job. Okay?
Of course.
Frightened of losing his job. He's coming to the end of his career, but he wanted to have a career touring the world and lecturing. And he didn't want that to be destroyed by telling the truth about what he'd found. So what did they find in this study when they compared? I'm going to just read this to you so I get it right. They had 18,500 children, 18,468 children in this group, a very big group of nearly 2,000 were unvaccinated, completely unvaccinated. And they followed them for a period of time. They found that chronic health conditions were 2.53 times more common in the vaccinated than the unvaccinated. Asthma, 4.25, autoimmune disease, 4.79 times more common. Atopic disease, 3.03, eczema, 1.31, neurodevelopmental disorder, 5.53. These are very big odds, okay? When you go to vaccine court, a twofold increased risk gets you compensation. Here we are with neurodevelopmental disorder, 5.53, okay? And if you look at chronic health conditions at 10 years of follow-up in those individuals, in the vaccinated, 57% have a chronic health condition compared with 17% in the unvaccinated. These data were absolutely damning, and because of that, he refused to publish. Now,
wow.
I mean, I can go into more detail about it, but all I'm going to say is this, that there are two things here. One is the finding of this effect, that vaccines are a major risk factor for chronic disease in children and could explain the disease epidemic in children in North America or throughout the Western world. But the other is that they refuse to publish. And that goes against everything I believe in. It goes against science. So asthma, for example, kills, let's have a look. Asthma kills 3,624 people in America, in the US alone, every year.
Yeah.
Those people could go to hell. Who cares about them? I'm more concerned about my career. I'm going to refuse to publish the data that may prevent those deaths going forward. I'm worried about losing my job. To hell with your job. Your job as a doctor, as an academic physician, is to put the patients first. There is absolutely no excuse for this behavior. It is appalling. So if you don't want to publish the truth, whether it supports your hypothesis or not, then you're not a scientist, and get out of science. Get out of medicine, because you don't deserve to be in it. And it makes me very angry, as you can probably tell. I rarely get angry after all this time, 35 years in this. But this is extraordinary, that doctors who are meant to set the standard in this kind of environment, putting patients first above all concerns, here are allowing patients to potentially die because they want to protect their own careers. So that's where we are as of Tuesday this week.
Wow. And this after the entire COVID saga, where a lot of people came forward, we saw with our own eyes as athletes collapsed on their respective fields or courts from obviously injecting themselves with these pharmaceutical products, let's call them. And certainly doctors, I remember when I used to go to my family doctor, she had in her office the Hippocratic Oath, first do no harm. Those were the first words, and it was proudly posted in her office so that we know that first and foremost, all doctors are supposed to do no harm. So if you have knowledge of the fact that a product produced by the pharmaceutical industry obviously does cause harm, then how would a doctor feel like in their consciousness or ethically, morally, to actually be able to prescribe these products? Because I know that a lot of them do to parents of very small young children. Mine were included in that. Um, so when I started doing my research, Dr. Wakefield, I remember seeing videos on social media. Parents were posting videos of their children in active seizures, in comas, not being communicative. So they were all sharing stories of regression, chronic illness, much like you spoke about, autoimmune disorders, speaking to how many things their children were experiencing. Why would you say, as an academic, as a doctor, as an activist, as a filmmaker, why do you think the mainstream still, much like what you just described about this Tuesday thing, why does the mainstream still resist acknowledging these very much lived experiences?
Well, I think there are at least two elements to it, if not more. One is the simple belief system that vaccines are the greatest thing that we've ever done. There were, to characterize that, and we can't criticize them. There was a government document, I think it was from the FDA in relation this time to polio vaccine, but it reflects the pervasive
Yes.
approach to the whole problem. And they said that effectively said, and it was after some neurological studies in mice had shown dangers of this vaccine. It said any perceived risk of harm from these vaccines, whether well founded or not, cannot be allowed to exist. In other words, even if the science is there to show that this vaccine is dangerous, that science cannot be allowed to exist. I mean, how Orwellian is that? I mean, it's absolutely staggering. Not only that that's what they said, but they were prepared to say it. Some buffoon put that in writing for us to read later, that they cannot be allowed to exist. Says who? I mean, incredible. So that's one thing. The other is money. The other
Yes,
is
of
money.
course.
The pharmaceutical industry make not only make billions out of vaccines, they make trillions out of the drugs that are required to treat the chronic diseases that the vaccines appear to be causing. From this study, in where it's 50 over 57% of the children who've been vaccinated have these chronic health conditions.
More than
So
half.
it's a massive income. And so what happens is that in this country, not in Canada, we have direct consumer advertising where the drug companies can advertise their drugs
Yes.
direct to consumer on television. Well, that is a huge income for the television companies. The nightly news networks are almost exclusively pharmaceutical industry ads. If they took that away, these networks would collapse. They would have to go back to reporting the real news, God forbid. And so there is a lot of money to be made from the pharmaceutical industry to put these ads out there.
Yes.
Bobby Kennedy is now changing that and
Yes.
saying you have to list every single adverse reaction possible, which could lead to 4-minute advertisements, which is going to be very expensive. However, what that does, I don't believe that they're there for the most part to sell drugs, these ads on television. I think they're there that they provide such a wonderful income to the television companies that they need to keep it going to maintain their lifestyle. If you it gives the drug companies control over the editorial. And I experienced this with Cheryl Atkinson, a very, very good journalist, used to work for CBS. And I went to interview with her at CBS in Washington, D.C. And this is many years ago. And she said, Andy, when we finish this interview and it goes for editing, as soon as it's been edited, we will get a call. I will get a call from, it'll come it'll come in 15 minutes. I'll get a call from upstairs from the money men saying, our sponsors have said that if you run this segment, they will withdraw their sponsorship.
Wow.
It will not run. It will not run. Okay. And so, and she was wrong. She was wrong. It was 5 minutes, not
Oh
50,
my goodness.
5 minutes. They called and cancelled it. So it gives this huge income from the pharmaceutical companies, gives them control over what will go out on television and what won't. And so that's the world we live in. And Bobby Kennedy is trying to change all of that right now. So it operates on various levels. But those are two of the principal sort of driving forces in why there is this extraordinary reluctance to acknowledge that vaccines are doing this. But in the face of this study from Michigan now, from a very big medical center and a very eminent quasi-scientist, in my opinion, then it's going to be impossible for them to refute.
I want to inform the audience based on what you just said. So during my career in healthcare, because I worked in healthcare, oddly and ironically enough, so I was a public servant, if you will. There was one time I was working for a hospital, and we had one of the news channels come there, and they were doing interviews with various people, some of which were in the medical, on the medical side, on the clinical side, nurses, doctors. And I remember I was friends with one of the nurses who had been interviewed. And she was actually very happy that the interview took place because she wanted people to hear about what the people on the ground had to say. So the people that were interacting with the public, with the patients had to say. And I remember fast forward 2 to 3 days later when the actual piece aired, it had been edited to a degree where pieces of the interview were taken and kind of put together. And the message that she gave during the interview was completely different in the way that they presented it on air. And she was absolutely furious because all of a sudden she was now portrayed as an individual who had a specific opinion or a specific view about what they had asked her about, which was completely opposite to what was her actual and real view. So I really want the audience to know that a lot of the things that we see, because oftentimes a lot of people even come to me and they say, well, where are the studies? And, show me the source. And unbeknownst to a lot of people, I'd like to take a quick break now to let you know that today's show is sponsored by my book, Against Medical Advice. This book is a memoir, and it tells the story of how I built my life back after suffering a stroke during my divorce. I discuss the nutritional, lifestyle, and mindset aspects that I put into practice to regain my health and rebuild my life. The book has been a labor of love, both writing it and publishing it, and I couldn't be more proud of it. Please pick up your copy from Amazon. For your very own signed copy, my email address is simone@simonegisondi.com. Oh, and I'd really appreciate it if you'd please consider leaving a review once you've read the book. And now, back to the show. A lot of the things that are presented in publications as well as on air are actually very far away from the actual truth, which of course speaks to the importance and necessity of the films that you have obviously brought to the public. It's important to do due diligence and dig deeper and be very discerning with the doctors that we interact with and what we read and what we listen to. But going back to the question I asked you, and I really wanted the audience to know, don't ever believe everything you see, especially when it comes to the news. But just going back around when I asked you about the mainstream and why it still resists acknowledging the lived experiences, and you did say that it's a two-pronged thing, one of which is money.
At least two.
What would you say? I just want to push a little bit further. Bill Gates is on the record in one of his TED Talks saying that if we do a good job, and I'm paraphrasing, if we do a good job with vaccines, we can reduce the world population by about 15%. Would you say that there is a even more sinister reason behind this whole campaign of vaccinations, especially vis-a-vis the fact that there is scientific data that proves that they are actually causing harm, especially to children, which is the time when they push very hard to administer them?
Yes, I mean, I think some years ago, if you'd asked me that question, I was still of the mind that how could people possibly deliberately inflict harm on their fellow man in this way, particularly doctors and scientists.
Mm-hmm.
And then I did made a film with Bobby Kennedy. And we were looking at tetanus vaccination in African countries, developing countries, that were being used to deliberately cause infertility in women without telling them. And so the tetanus vaccine, which was being given to prevent neonatal tetanus, was hybridized, was joined together in a chemical reaction with an HCG, human chorionic gonadotrophin, which is essential to maintenance of a healthy pregnancy.
Yes.
Whereby the women who were given this would develop antibodies to HCG and would therefore be unable to sustain a pregnancy. They would be infertile.
Yeah.
And this was a deliberate policy funded in part by the Gates Foundation, where they'd made this vaccine as effectively a contraceptive. There was no informed consent. These women were not told. Fertility amongst African women in particular is an extremely important social gift, I suppose, if you like. It's very important to their marriageability and their lives. If they can't have children, they're going to be left. It's terrible. It's absolutely disgraceful that
Absolutely.
this was done, and in the absence of any informed consent whatsoever. So it's called a diabolical agenda after one of the mothers, a comment made by one of the mothers, highly articulate African woman who said, this is what they've been doing and it's diabolical. And it is absolutely diabolical. It flies in the face of all medical ethics. And so after making that film, I came to the conclusion that yes, there is a deliberate attempt to use vaccination strategy to harm people in this way. And that is runs the danger of making you very, very cynical. And I've tried to avoid that because I am of the mind that there are many more good people in the world than there are bad people.
Yes.
But yeah, it was quite a shock.
Yeah, and it's certainly important to take all pieces of information into account when you make decisions, or at the very least, when you ready yourself to try to prevent disease in your families, in your children. And of course, what are those pieces of information? I know we're very busy with our lives and our jobs, but when there is such a price to pay, much of which, as Dr. Rob Malone said, when you do such things, it's often irreversible. So it's important to make these decisions with a lot of information at hand from the beginning. Now, on that front, what do you believe are the most urgent research questions that are still being ignored about vaccines and children's health in today's world today?
Well, I think the definitive study, which was presented in part
Tuesday.
last Tuesday this week, is the comparison of health outcomes in vaccinated versus unvaccinated children. It was an imperfect study because it will have missed the great majority of diagnoses of autism because their age cutoff for stop following these children came long before the peak incidence of autism diagnosis. So it was flawed in that respect, but nonetheless, in every other respect, it was a sound study, and we need to take that very seriously. So rather than ignoring it, the American Congress, the US Congress, and the media need to get onto this and demand that we do this study elsewhere. One of the keys to the validity of science is that it can be replicated in different populations. We've now had vaccinated, unvaccinated studies in at least 4 populations, and they've all shown uniformly worse health outcomes in children who receive the vaccines compared with the unvaccinated. And in those circumstances, at the very least, not only do we do more research urgently, as a matter of urgency, we are entirely honest with the public about the outcomes of the study, and we take away all vaccine mandates that should never have been there in the first place. You simply cannot and should never force anyone to undergo a medical procedure. You should not coerce them. You should not bully them or lie to them. You should not threaten them in any way. They should be free based upon full information of all the risks and benefits to make a decision on their behalf or behalf of their children. So any vaccine mandate for any reason in this country, in every country, should be taken away. And the research will then get done and it will confirm or deny, but looking increasing like it will confirm that there is a problem. And parents need to be fully informed about the nature and the extent of that problem in their decision-making process. And that's what I believe will happen under Bobby Kennedy. And that's where we need to be. And then everything will flow from that point forward.
Yes, he's such a ray of hope. And a lot of people in the public, I mean, I've seen it on my social media, they are such fans of his work because he is the only hope that the public feels they have to be able to make decisions and empower themselves to be able to decide for themselves, their children, and their families when it comes especially to this aspect of health. Now, Dr. Wakefield, what would you say that your story reveals about how science itself works or doesn't work for that matter, especially when power, money, like you mentioned, and the public health narratives are involved?
Well, when I got into it, I really believed naively that, you did science, you published whether it was positive or negative, whether it supported your hypothesis, you were diligent, you were honest, and in medical science, you put the patient's concerns, you take them very seriously.
Yes.
That's where clinical medicine begins and ends with the patient's story given to you by the patient or by their parents. And that must be taken into account. I came to learn that it wasn't. I remember one day at the Royal Free Hospital, the Dean, Harry Zuckerman, called all of the senior academics into the lecture theatre and said, the government have just told us that they are going to stop funding for the great majority of medical research, medical science. And they have told us that this is a good opportunity for you to get into a strategic liaison with the pharmaceutical companies to fund your research instead. What does that mean? I mean, that made my blood run cold because it means that the pharmaceutical industry now gets to determine what research is funded in UK medical institutions. And more importantly, they get to decide what research is not funded. And questions about vaccines are never going to get funded. So that was a very dark time for me. And I set out to find ways of continuing the vaccine safety research, without grants from the government and most certainly without grants from some of the pharmaceutical industry. So it's a real problem, and some medical science has to take a long, hard look at itself now because it's a mess. The majority is propaganda for drug companies. It's not believable. It's not credible. It's not reproducible. And it's not acting in certainly the patient's best interest. So, and the shame is that buried in all this, there are some really wonderful medical advances.
Absolutely.
They get tarred with the same brush because there are some bad people out there. Pharmaceutical industries are great when everything's going well and they're making a profit and their drugs are doing good. It's fine, but when there's a problem, this is when their true colors show. When there's a problem with one of their drugs, they seem to go to any length at all. I remember Merck, there was a trial. They looked at the mortality from. It was obvious to doctors that a lot of people were dying from Vioxx, Merck's drug Vioxx. And it turned out to be correct. But 500,000 people died in this country, apparently from strokes and heart attacks caused by Vioxx. It turned out that Merck were aware of this risk.
Oh, wow.
Before it was put on the market. Anyway, what happened? They were called to account, and in a court case in Australia, they produced these emails, an email exchange, document exchange between members of the company saying about doctors who dissented from the safety of Vioxx, we may have to seek them out and destroy them where they live. It's company policy. Not conspiracy theory, it's company policy. We may have to seek them out and destroy them where they live. Think about doctors who are doing their job and expressing concerns about this drug. That's the kind of people you're dealing with when things don't go well.
That is so scary when you think about the fact that you go out into the world and you put your health in the hands of doctors. You're taking a chance, literally. But thank you so much for your courage. And I know there are many doctors, and it's difficult for people in the public and especially patients of doctors to discern any of that, because we put the trust in the academics and the scientists and the doctors to do this research. They go to their respective schools where they learn all of this. So it's a very tightrope kind of line for us to know whether doctors, and these are a lot of the conversations I have with people, do doctors actually know and not say anything? Are they so oblivious to the obvious, or do they know and they just ignore the fact? Or are they bought into the idea that, yes, I would give this vaccine? I mean, I've gone to doctors where they said, I've vaccinated all my 5 kids. Why are you so hesitant?
Yeah. I
And
think all of the above, different doctors for different
that's
reasons,
right.
and continue despite the knowledge. Some
Yes.
are so bought into the narrative from the drug companies and the CDC that they will do it, whatever, putting the
Hmm.
blame. Oh, well, they told me it's safe, so I can do it. Well, that's not good enough, I'm afraid. The patient, you are responsible for this patient, and therefore you need to do your homework. You need to check the facts and figures and make sure that what you're telling them and what you're doing to their children is based upon accurate science. And if it's not, then you're responsible. Don't hand it off to someone else, even though they are equally culpable.
Yes. Now, Dr. Wakefield, do you see yourself overall as a cautionary tale, especially in the medical world, so that the world at large would be made aware of what they need to watch out for? Or do you see yourself as a pioneer? Or perhaps maybe both?
I don't I don't really see myself as anything, actually. I don't really think about it. I'd like to be a great filmmaker, and that would be fun. But
You
think I'm in.
definitely are.
I got into it too late to be a Spielberg. I do love the creative process. I don't really think about it too hard, but I do. The way I look at this is a lot of bad things happen to me, and I can't pretend there wasn't a time when I was profoundly depressed and it had a huge impact on my family. But I got into it. I had a choice. I was a consenting adult. Okay, I could have stopped. The dean said stop. I could have stopped. I didn't. I
Absolutely.
redoubled my efforts. So I made a decision based on informed consent, if you like.
Hmm.
These children didn't. They didn't get that opportunity. Their parents didn't get that opportunity. They were not told the truth. And their lives, in many cases, are forever compromised.
Yes.
So let's not feel sorry for Andy Wakefield. It's just part of the deal that you sign up for. These children don't have a voice, and someone needs to be that voice.
Yes.
And that's the role that at least I share with some very, very good colleagues now, people like Peter McCullough and others. But that's our responsibility. And so, yeah, I guess that's how I see my role.
I think, I mean, for myself, especially because, like I said, right now, since the whole COVID era, a lot has come to light. But you opened the floodgates back in the day. And I say this because when I started doing my research for my very own personal reasons, it was your work that I stumbled upon. There was no Dr. Peter McCullough speaking against anything at that time. Um, there was yourself, there was Dr. Thompson. So I just want to say for myself, I was very grateful to have that kind of information at that time. Because imagine if I had not stumbled upon anything, my decisions for my children would have been made very differently. But at least if you can plant a seed to make people stop and think and have second questions or hesitate and say, you know what, I need more information before I decide on something that's not undoable, then at the very least, I really want people to know. And this is why I wanted to have this conversation with you, because to me, you were both the cautionary tale and the pioneer. So I wanted to let the audience know that before what they know right now, as a result of the whole COVID era, there was Dr. Andrew Wakefield who kind of like opened the lid and the floodgates of information and truth and spoke with courage against a lot of the things that the pharmaceutical industry was doing in a way that was actually harmful to people. So, on that note, what advice would you give to young scientists today, or even doctors for that matter, who see something troubling much like what you were talking about, what was brought to the Senate on Tuesday, but they fear the consequences of speaking out. What advice would you give them?
You must put your patients first above every other consideration. That's what you signed up for. And if you're not prepared to do that, then quit. Walk away now. Become a pathologist. Look down a microscope, but don't involve yourself in patient care. And if you do a study, be prepared to publish it. Don't walk away from it because it doesn't fit with your prior beliefs. If you do that, you're not a scientist and you shouldn't be in this at all. So get out. Um, yes, that's my firm
Thank
conviction.
you for that. I really hope that everybody will have the courage that you have and have had, not only to bring that truth and to be able to speak even to the people in academia or in the medical world, but also to publish, to go even above and beyond, much like the way you did, to speak to all of these factors through the way that you do, through your movies and through published work. Um, so, if you could share one message with the parents listening today, what would that be?
Well, two things. One is mothers trust your instinct, okay? Your maternal instinct about what ails your child and your child's development. Everything about them is you have a unique gift that's
Yes,
evolved over since life first appeared on this planet. And it is a very, very powerful gift. You must trust that, certainly over and above whatever you're told about your child by pediatricians. You know them far better. Trust in that. The other
absolutely.
is watch the films because the films I've made were intended to do the heavy lifting for you. It's a vast subject, very complicated, and the intent was to make it easy, entertaining, and much easier to understand, to do the heavy lifting for you. So watch the films and then make up your minds. In the meantime, God bless Canada and God bless Toronto Irish Rugby Club. I think they probably need it.
That's just for our Canadian audience, but I know that my fellow Americans, and I lived in Florida for a whole bunch of time, and I know how invested everybody is in the health of their families and their children. And I've seen it, especially the way that it unfolded since, of course, 2020 when COVID came to be. So it's important for everybody to, of course, take all the information into account. And this has been the center, front and center in my message. Like, always make sure you don't allow anybody to coerce you or to pressure you into making decisions about your health or that of your children, because there are many things that are part of that that cannot be undone. And Dr. Robert Malone spoke about this as well. But also, much like what you said, if you instinctually feel that something just doesn't feel right, listen to that and at least do more research. Now, what about yourself, Dr. Wakefield? If you could go back and speak to your younger self before all of this began, what would you say?
I would say you should, certain things you might have nuanced, you might have done differently. The main thrust of what you did, do it. Um, Wisdom of years means you would have done it in a sort of more nuanced way, more you would have not been so trusting of the authorities, the people who you shared the information with, because they were not acting in the interests of the children or you, but in the interests of their own self-preservation. And that went for government officials in many cases. So I would approach it as with a little more skepticism, I think, about, certainly disclosing things to people because they can come back to they can be turned around, rather like the interview you were talking about that
Oh,
your
yes, at the
your
hospital.
did at the hospital, that they can cut it any way they want, and that's what they do.
Hmm.
Do live interviews. Don't do recorded interviews with mainstream media because they will do that. They will edit the hell out of it and it'll come out as a completely different story. Insist on live interviews so that they can't edit it. And that's another thing I've learned.
Yeah, that's actually very important. Be very, very discerning. Now, as a doctor, Dr. Wakefield, 2 decades later, if you will, we've learned about the gut brain immune axis, which is important. And that confirms or deepens what you've been pointing towards even back in the day. So, what would you say that we've learned that we should pay attention to about this?
Well, the body is a whole. I mean, the way medicine has sort of evolved over the years is the brain isn't connected to the gut, isn't connected to the toes. You know, we're all different, which of course we're not. We're all one body, and they talk. These organs and tissues talk to each other all the time,
Yes.
and the gut talks to the brain. And the chief medical officer in the UK, said to me, he said, "I just don't get this. I do not get." We had this big meeting. He said, "I do not understand this gut-brain axis nonsense you're talking about, how
Wow.
something affecting the gut can affect the brain." I said, "Well, look, I'll take you for a beer and show you." And he thought I was offering to buy him a beer. I don't want to buy him a beer. I can't stand the man. The point I was trying to make is if you drink a pint of beer, within a few minutes, you'll feel the effect in your brain. In other words, toxins, in this case, alcohol from the gut, impact the brain. I was trying to put it simply for him because he's the chief medical officer. They're not very clever, and and he really didn't get it. He really didn't get it. But we take medication, oral medication for psychiatric and neurological conditions. Whatever's in the gut will get in and affect the brain in many cases. And so the theory at the time was that there were toxic residues from gluten and casein from cow's milk products that had opioid morphine-like activity, and that this was affecting the developing brain. And it was a very interesting idea, and it's not been disproven in any way. So that was the sort of thinking at the time, and I was enlightened to this by parents once again, parental insight. And so the gut-brain axis has now become widely accepted. It was poo-pooed at the time. It's widely accepted now, and people are designing treatments on the gut-brain axis and modifying the gut microbiome to alter neurological and cognitive functioning. And it's fascinating. We've realized that the knee bone's connected to the hip bone. We now know that the body is one and functions as one and is interrelated. And why did we ever think otherwise? But the relationship between the gut and the brain is a huge field now, and a very productive field of medical research, and very promising in terms of our ability to extrapolate from it to help patients to make a difference in their lives. So yeah, that was an interesting. I mean, we took on a lot of things. We took on an awful lot of dogma at the time, but there it was. There it was.
I love the way that you actually tried to exemplify that with a real case. Let me take you for a beer, so that you could actually understand that in very simplistic terms, rather than the entire clinical academic ways that, with a lot of jargon, that things are explained, especially in light of the fact that a lot of the neurotransmitters are actually made in the gut.
Yes.
So clearly, that's an important factor that should be taken into account, especially when we want to have brain health. And of course, I studied a lot of integrative health, and a lot of my teachers were telling me about how the epicenter of health is actually the gut. So once the gut is okay, a lot of everything else will be okay. So always take care of the gut. And of course, many in the integrative medicine field today talk about leaky gut, microbiome imbalances, and even neuroinflammation. That's a huge topic. So, of course, vaccines interact with these pathways in ways that clearly accelerate chronic illness, much like you said that you've learned from parents. So, it's important for those things to be taken into account. Now, before we let you go, Dr. Wakefield, I'd love to do something that I do here on the podcast, a
Not
little
going to make me
rapid
sick,
fire.
are you?
It's a little rapid fire kind of round. Short, straight from the heart answers that the listeners can hear, I guess, a truth, your truth, in a distilled way. So if you're ready, I would love to ask these questions.
Not sure I'm ready, but I'll give it a go.
Okay. What's one truth about children's health that you wish every parent knew?
That it's best understood by their mother.
Thank you. What is the most misunderstood thing about your work?
Wow. I suppose the 1998 paper has been so grossly misrepresented as claiming MMR vaccine causes autism when it said, in fact, completely the opposite. This study does not prove an association. Further work is necessary.
Absolutely. That's so important because, like I said towards the beginning, you were never anti-vaccine, but rather that more information is needed. If you were to, aside, of course, from, and I'm going to put them in the show notes, what one book, film, or study do you believe people should read to understand this issue more deeply? I recommend your movie Vaxxed. Of course, that was very impactful for me, but I defer to you. What would be one book?
Vaxxed is key. Vaxxed is key because it's not coming from me. It's coming from a senior member of the CDC saying this is what we did. So it's not my opinion. It's fact from him. And it's a very good way of getting into this whole arena. Once you watch that, you will want to watch other things, read other things, but it's a
Yes.
gateway introduction to this whole issue. And so I would say Vaxxed is the key. And if you go to wakefieldmediagroup.com, then you can watch Vaxxed there, wakefieldmediagroup.com. Watch Vaxxed and all the other movies. But I think I'll give you an example, and this is what I'm told, and I'm going to check it with him when I see him soon, is that Senator Ron Johnson's vaccine inquiries in the US Senate were stimulated by having watched Vaxxed. Once he watched it, he couldn't unwatch it. And that's really what drove the subsequent hearings and have shed light on so much. So watch the movie.
Absolutely. Vaxxed was one of the things that was most impactful for me. So I highly recommend. Now, if you had one sentence to define what science should be, what would that be?
It is the unbridled exploration of ideas pertaining to science without prejudice, without coercion, and with the ascent of knowledge as the priority. There is no endpoint in science. One question raises many more questions. It's like going up a tree. One branch gives rise to many branches, gives rise to many more branches. That's the nature of science.
That's right. Such an amazing way to actually describe it. Now, what would be one word that describes how you yourself want to be remembered, Dr. Wakefield?
By my children. However other people remember me isn't, I'll be forgotten in no time at all. But my children, they forgive me for time spent away from them, but their children and their children's children hopefully will be healthier as a consequence of what I've done.
What an amazing thing to say. Thank you for that. And lastly, how do you foresee the world of vaccines in the future?
I think there is evolving now a huge and deserved distrust in the regulatory authorities and the drug companies. They have brought this upon themselves. It's no good blaming you or you and I for having this conversation about vaccines or raising the issue. They have created this environment. They have done this. They are wholly, totally, and utterly responsible for the situation themselves, whether they believe that or want to believe it or not. And so I think we are in for a huge readjustment. I think many of the vaccines on the schedule will go. Others will need to be considered very, very carefully. And alternatives are going to need to be thought of.
Oh, that is so amazing. That's such a ray of hope for the future. Thank you so much. And Dr. Wakefield, thank you for your courage, not just to speak on my show about this important topic, but just throughout time, and for all the effort that you put into the research that you've done to speak out, to question the narrative. Thank you for your candor and your willingness to stand in your truth, even when the cost was very high for you, as we all know. Because, of course, conversations like this remind us that science is not just data on a page. And you prove that it's actually the lives of children, families, communities who deserve to be heard. And thank you for the movies that you've brought forward and the information that you continue to bring forward so that people can have that information at hand when making their decisions. Because no matter where people stand on the spectrum of belief about vaccines, and we all have our own spot or space on that spectrum, what cannot be denied is the importance of open inquiry, honest dialogue, which I know you have been such a big proponent of, and of course the freedom to ask the hardest questions, because clearly that's how truth emerges and that's how healing begins. And much like what you said, yes, they brought this upon themselves. If there was nothing to discuss on this topic, we wouldn't be having this conversation. I wouldn't be asking you the questions I've asked you so that people can make their decisions in a way that is made with all the information at hand. It's been an honor to share the space with you today, Dr. Wakefield. Thank you so much for sharing not just your story and your wisdom, but everything that parents should know and should be made aware of for the future. And of course, I think you mentioned that all of your work can be found at wakefieldmediagroup.com. Is there anywhere else that the audience can find your work? Anything that you've published, or even if they want to see what else you're going to be working on for the future?
Yes, they can also go to yow.tv, yow.tv. It's a hybrid Eastern word for freedom, yow.tv. So, but wakefieldmediagroup.com.
And yow.tv. Excellent. Thank you so much, Dr. Wakefield. I hope that we can have another conversation in the near future as truth emerges and the ever evolving world of vaccine changes in a way that at least it's going to be beneficial for the health of humanity.
Thank you very much. Thank you.
Thank you so much for joining me on Health Confidential, where healing is more than just symptom relief. It's a return to the body's original blueprint, guided by truth, intuition, and cellular intelligence. If today's episode resonated with you, please share it with someone who needs to hear it, and follow me on Instagram at simone.gisondi for daily insights, behind the scenes wisdom, and holistic inspiration. To explore working with me and to get your own custom-made healing protocol, visit simonegisondi.com and book your private consultation to start working together. Remember, your body is sacred, your intuition is gold, and healing is your birthright. I'm Simone Gisondi, and this has been Health Confidential. See you in the next episode.